Bismillahirrahmanirrahim. So the next topic of our discussion is gastroesophageal reflux disease, also commonly known as GERD. So gastroesophageal reflux disease is characterized by reflux of gastric contents and gastric acid into the esophagus. The disease most commonly manifests as heartburn. The esophageal mucosa is stratified squamous epithelium. This stratified squamous epithelium is resistant to abrasions by the food, but it is sensitive to acid. This stratified squamous epithelium constitutes the first line of defense against the esophageal damage. The second protective mechanism is presence of submucosal glands in the proximal and distal esophagus. These submucosal glands secrete mucin and bicarbonate. This mucin increases the lubrication and allows the food to pass through the esophagus smoothly. The mucin and bicarbonates are also protective against the acid. The third protective mechanism is esophageal sphincter tone. The gastroesophageal sphincter is always constricted and it acts as a one-way valve, allowing the passage of food from only esophagus to stomach. The constricted tone of the gastroesophageal sphincter does not allow the reflux of gastric contents into the esophagus. So all these three mechanisms protect the esophageal mucosa from the damage. There are certain risk factors for the gastroesophageal reflux disease, and the presence of these risk factors can result in reflux of acid in the esophagus. The acid secreted by the stomach is hydrochloric acid, which damages the esophageal epithelium, resulting in inflammation known as reflux esophagitis. The risk factors of gastroesophageal reflux disease can be classified into two types. The first are those which result in decreased gastroesophageal sphincter tone, and the second is increased abdominal pressure. The gastroesophageal sphincter is constricted and does not allow the reflux of gastric contents into the esophagus. But in case of certain neurological diseases, excessive alcohol use, smoking, and certain CNS depressant drugs result in decreased gastroesophageal sphincter tone, hence allowing the reflux of gastric contents into the esophagus. The risk factors associated with increased abdominal pressure include overeating, obesity, pregnancy, hiatal hernia, and delayed gastric emptying. Hiatal hernia means protrusion of stomach through the diaphragm into the thorax. This leaves a part of the stomach above the diaphragm, hence resulting in increased pressure, which allows the reflux of gastric contents into esophagus. Delayed gastric emptying is associated with sedentary lifestyle and lack of exercise. Endoscopy reveals hyperemia or extreme redness of the esophagus, which is due to the damage by the hydrochloric acid. The histological picture reveals eosinophilic infiltration in the mucosa, and there is hyperplasia of the basal zone, more than 20% of the epithelial thickness. The lamina propria also gets elongated and may often extend into upper one-third of the esophagus. The presenting age is mostly more than 40 years, and the patient commonly presents with dysphagia. Dysphagia means difficulty in swallowing, heartburn, and the patient often complains of regurgitation of gastric contents, producing a sour taste in the mouth. Often the patient presents with severe chest pain, which can mimic a myocardial infarction. The diagnosis is based on the clinical signs of the disease. In certain cases, the endoscopy may also be required, and the treatment is with lifestyle modifications and proton pump inhibitors. The lifestyle modifications include correcting the eating habits of the patient, inculcation of exercise and physical activity in the routine, smoking and alcohol cessation. Moreover, the patient is also advised to decrease the consumption of tea and coffee. The proton pump inhibitors are taken almost 20 to 30 minutes before breakfast. So this brings us to the end of discussion about gastroesophageal reflux disease. If you have any questions, do let us know in the comment section. Thank you.